let me know if you can hear me speak. Just say yes or no. Okay, so I'm so excited. He's a 10 is so hilarious, and I am actually so proud of you all because I can tell you're learning, and that makes me very, very happy. Okay, so, and there's actually so much that we might have to do 2 parts because it's just going to be way too long, and it's really good. All right, so here we go. Hold on, I have it. I actually have to go through them and just see there's a lot of repeats, so let's do it. So he's a 10. He's a 10. And remember, we're doing eye care edition. We're not doing not eye care. We're only doing eye care. So he's a 10, but he reads your name tag and calls you by your first name. This happens to me a lot, and at first I was getting upset, but then I was like, whatever, you know, I'm here to do the best I can. So at first I was like, you're definitely a 3. Now I'm like, let's do a 6. So he's a 10, but now he's a 6. Next one. He's a 10, but he sleeps in his contact lenses for 1 year. That is immediate 2. Immediate. Because the risk of sleeping in contact lenses is just so not worth it. And when I have patients that are new patients to me and they're coming in and they're almost bragging that they're sleeping in their contacts, it really saddens me that we're still talking about the fact that people are sleeping in contact lenses. Don't do it, it's not worth it. So he sleeps in his contact lenses, he goes from 10 to very low. There were a lot of them saying sleeping in contact lenses. Next one, bingo, love this one. He's a 10, but he uses Visine. That's a 4. I'll give it a 4. So he goes from 10 to 4, just because you're bragging about using Visine. You should not be using Visine. It is not good for your eyes, and actually in long run it will just give you more red eye, dry eye. It can give you elevated eye pressures. It's just, don't do it. And also, I guess, don't brag about it. Don't use Visine. He's a 10, but he doesn't wash his face. That's a 2. Like, let's talk about hygiene. Like, you should be washing your face. And in fact, you shouldn't just be washing your face, you should be spending extra 30 seconds washing the lashes and your eyebrows. It's still hair, it still has debris, and it still collects a lot of debris and pollen. And remember the Demodex. There is a thing, it's called Demodex mite, and it will overgrow, and you will have this thing that's called Blepharitis, red eyes, styes, all from poor eyelid and face hygiene. So remember to wash your face. But yeah, if you're a 10 but you're not washing your face, that's a 2. Like, you should be washing your face. He's a 10, but he wears his dailies for 2 weeks. I mean, they're called dailies for a reason, so I think it'll definitely be a 5. It's just because, and the reason it's 5 and not a 0, because, I mean, if you clean them, it'd still be okay. But the reason we put you into a daily, it's because of the superior comfort, and you don't have to wash them, you save a lot of plastic, which is so much better for the environment. Yeah. If it's a daily, just stick with a daily. If you prefer extended wear, then just ask your eye doctor and get an extended wear contact lenses. There's really no reason being in dailies and then overwear them. I actually had a patient who was still wearing samples I provided them a year ago, which was a very interesting conversation we had to have. He's a 10. He's a 10, but he waited weeks to go to an eye doctor after seeing flashes. That really sends me. I think will be a 6, because he probably still sees because he drove himself to an eye doctor. But this is something that I will always say: if you start seeing flashes or floaters, call your eye doctor right away. It is considered an eye emergency, and we need to make sure the retina is healthy and it's intact, and it's not there are no tears that are stimulating the retina and creating these flashes or floaters. So you can be a 10, but if you're waiting long time on your flashes and floaters, that 10 goes down. This is a good one. He's a 10, but he doesn't get eye exams because he doesn't need glasses. So let's talk about eye exams and why we need them. An eye exam and vision check and getting your glasses prescription is just a fraction of what an eye exam means. When you come in for an eye exam, we check everything. We check the whole eyeball and all eyeball health, front to back, including your nerve. Therefore, just because you see well, it doesn't mean the eyeball is healthy. So if he's a 10, but he doesn't get an eye exam because he doesn't need glasses, that's a 5. I'll say, you know what, you're 5. Okay, next one. I hope you guys are loving these. I am having a lot of fun. Okay, he's a 10, but he rubs his eyes. Well, if you're a 10 and you rub your eyes, very soon you will be a 7. Because a lot of rubbing will not only, cause redness and swelling and actually a lot of stretching of your skin. You can also rub yourself a cone. So we do have situations when children are rubbing their eyes so much, they're turning their corneas into a cone, meaning keratoconus. So definitely don't rub your eyes, because you're going to go from 10 to a 7 pretty quickly. Ooh, this is a good one. He's a 10, but he sniffs his eye crusties. Okay, I have never seen this happen, but this is totally weird, and I would say now you're 4. If you're having eye crusties, you're probably having blepharitis, you're probably having Demodex, and that's something that needs to be addressed, because Demodex is contagious. So I see patients that are young parents, and we get it, they're tired, that they're so busy, and I always treat my young parents, because it is so much easier to treat a parent versus a child that already has Demodex from their parent. So yeah, definitely just treat your blepharitis. Oh, he's a 10, but he has blepharitis and never cleans his lashes. I will say this is a 5, because I have seen actually people that I can tell across the table, I'm sitting at the restaurant, that they're having some type of ocular surface inflammation. Their eyes are red, their lids are swollen, and it's just, if you have been diagnosed with blepharitis, you need to maintain it. This is something that you just have to maintain. It's not something that will just magically go away. You do need a consistent eyelid hygiene to remove the bacteria, to clean the lashes, and always remember, you need to clean the eyebrows as well. I also have a good analogy. I always talk to my patients about, what does eyelid hygiene mean? I mean, you brush your teeth, it's kind of the same thing. You brush your teeth, you clean your lashes, move on. He's a 10, but he doesn't wear safety eyewear. I'd say a 7. That's something that is very easily fixed if he understands the risks. Oh, he's a 10, but he swears by Visine. I mean, honestly, Visine is so readily available everywhere. I was away in a different country and there was Visine. Visine, they're having like superior marketing. And I think our job is just to go ahead and educate our patients that long term you should not be using Visine. And in fact, if your eyeballs are red for more than 5 days, you definitely need to go see an eye care provider to check why are they red. They should not be red. Your eyeballs should not be red unless you didn't sleep well, you were sick. So those things that can cause redness, but overall you should not be having red eyeballs for extended period of time. Now, okay, this person really has been on a roll today. He's a 10. He's a 10. He has chlamydia in his eyes. Well, I guess that's what happens when you're a 10. But yeah, this is something that definitely needs to be treated. It is contagious, and actually chronic not treated chlamydia can cause scarring of the ocular surface and of course the vision loss. Okay, this is great. This is a good one. He's a 10, but he's got stigma in his eye. Actually, this has happened to me, and it usually happens in these like social events, and you know, someone finds out you're an eye doctor and be like, oh, I have stigma in my eyes. And it's just something that, what do? Do I start telling him this is not how you pronounce it, or do you just like let it slide and be like, whatever you want to call it stigma, call it stigma? But for me, this goes down to a 7 immediately, just because that's not it. So yeah, that's not stigma. It's actually what this 10 means is astigmatism, which is the shape of the front of the surface of the eye, and all it does, it just bends the light in a funny way, and we do correct it with contacts or glasses so patients are more comfortable driving at night if astigmatism is a little bit higher. So yeah, don't say stigma, it's astigmatism. He's a 10, but he wears AccuView 2s. So I would say this is an 8 because, and this is, I think this is a very much like an inside joke because AccuView 2s is a really, really old lens. I actually think they stopped making this lens a while ago, and we have such great new alternatives for contact lenses. So yeah, always ask your eye doctor when you go for contact lens fitting, even if you love your contact lenses, is there anything new? Is there anything better than last year? Because we always get new lenses, always new materials are coming out, new prescriptions are able to be covered, and I still get patients that come to me and say, oh, I was told I can't wear contact lenses. Well, not then, but now yes, so let's do it. It's just such a great alternative to correct your vision. You don't always have to wear glasses. I mean, if you love glasses, please do it. But I look at ways to correct vision as different shoes. You don't have to have one pair of shoes. You have multiple pairs of shoes. You can have multiple ways to correct your vision. I mean, if you play sports, wear contacts. If you're just doing something around the house, you can wear glasses. We also have an eye drop to help with near vision in those young patients that are starting to become a little bit presbyopic, having that little bit of up close vision. So there's just so many alternatives. You don't always have to wear glasses. So always ask your eye doctor, is there anything new? Because we always have something new for our patients. He's a 10, but he doesn't want to dilate or take fundus pictures. I think that's just, that will go to an 8, because you know why? I will bring them back for that dilation. The reason we dilate, and I hope you're gonna like this analogy, or if I have any dentists in here, they will appreciate it. The reason we dilate and why we need to dilate, we need to examine the inside of the eyeball, right? So the eyeball is round. We only see the surface right now, but in order for me to examine on the inside, we need to dilate. And once we dilate it, the iris is really large. We can examine on the inside. So the way I explain to my patients is when you go to a dentist, and you just smile at them. You do not open your mouth. This is what dilation means. It's like you came to see me, you blinked your eyes at me, but you did not let me dilate, so I don't even know what's going on the inside. So always dilate. If you can't dilate, you have to go to work, or if there's a, whatever reason you cannot dilate that day, take the fundus photo. It's a great alternative. It doesn't replace dilation, but it's such a good way to, number one, see what's going on, and track year from year to year. So I have patients that came in this year and then they come back next year and we see certain things like a new freckle or there's some hemorrhaging going on. It really allows us to see what happened last year and what's happening now. So I always recommend my patients, I prefer to do both. We do pictures and then we dilate, or vice versa. But yeah, definitely make sure when you do an eye exam, when you go in for an eye exam, that you are being dilated. That really means you're getting a full comprehensive eye exam. Okay, let's see what else we have here. He's a 10. He doesn't call to cancel an appointment. This one is, I don't love this one. So this one will take you down to a 6, and I'll explain why. There are so many patients that need to be seen for an eye exam, and usually doctors are so busy, there's a wait list. So if you don't cancel, that means your spot will be just wasted, and we could have been seeing a patient that is waiting with a red eye, or they're going away and they need to be seen, and now that time is just wasted. You didn't take it and you didn't let us know so we could bring in someone else. So that really makes me sad when this happens. It's just, we do everything to accommodate our patients, and don't do it. Just cancel it ahead of time, let them know, or reschedule. Let your eye doctor know. He's a 10, but says neither when asked 1 or 2. So I know a lot of patients stress out when they say 1 or 2, which one is better? And they get very stressed out. It's not a real test. So I want you to remember, when you do an eye exam, and your eye doctor checks you for prescription, and we use a phoropter to do that big funny glasses. It's not a test. We're really doing multiple things at the same time. Number one, and I do my own refractions. I don't have techs to do it just because it is such a good way for me to assess a patient. Although they're sitting behind the phoropter, I am listening very, very carefully. And I can tell perhaps this patient has dry eye, because I can tell they can't read, but once they blink, everything becomes clear. I am going to be assessing that patient for dry eye. So, or the patient is having difficulties with letters or smaller letters, or it's just such a comprehensive test. It's not just checking for prescription. So when a doctor asks 1 or 2, what you want to do is just pick the better one. There's no right or wrong. And what I want you to remember, we don't just ask one time. We recheck your answer multiple times. So you will end up with a good prescription, I promise. And don't stress out. Just go with one that's clear, or whatever the doctor is asking you to tell them. Do not stress out. It is very simple, very straightforward. And if you can't see it, just say, I don't see it. That's fine too. We'll figure it out. Okay, let's see what else. We have so many. Okay, so he's a 10, but he doesn't wear sunglasses in the sun. I mean, again, if you don't wear sunglasses in the sun, you will be a 6. Because what sunglasses do, they're not only protecting the eyeball, they're protecting the skin around your eyeball, and it's so delicate. So yeah, again, if you're a 10, you're not wearing your sunglasses, you'll be a 7 very soon. So definitely stick with sunglasses. Let's see, I have so many. A lot of people are saying contact lenses, which makes me so happy. Okay, he's a 10, but he always works and reads in the dark. Actually, I will say it's a 9 because it's not a really big deal. We don't have any scientific evidence that reading in the dark will harm your eyeballs. All it will do is just give you eye strain, perhaps a headache, so it's not a big deal. I don't recommend it. I actually don't like reading in the dark. I think it's just like, why would I stress my eyeballs? But if that works for him, please, not a problem. Okay, so he's a 10. He does sun gazing. What is sun gazing? There's actually some practices in South Asia that believe that looking at the sun, sunrise or sundown will help and cure their eyes from whatever diseases they're having. And yeah, definitely don't recommend it. We know that you can get actually solar retinopathy, and that is irreversible, which is damage to the retina right in the center, right in your macula. And macula is responsible for seeing clear straight ahead. So why do you see clear? Because your macula is healthy. So when you're looking at the sun, you're burning that retina, and you will lose your central vision. You will have your peripheral vision because your optic nerve still intact, but you will have damaged macula. I think this is a big one. He's a 10, but he buys colored contact lenses at a gas station. That's a 1. You're definitely a 1 now. You should know better at this point that gas station is for getting gas and not your contact lenses. So definitely a no. Contact lenses, if someone is selling contact lenses without a prescription, it's illegal. Like, this is not okay. You should not be purchasing, well, they shouldn't be selling it, but you also shouldn't be purchasing it. So I will say it's a 1. Don't do it. You can get an infection, you can lose your vision. We never know how they sterilize that lens, what materials you're using, and it's just, no. If you want colored contact lenses, there's nothing wrong with them. They're great colored contact lenses out there, but you do need to have a proper fit with your eye care provider. And yeah, immediately no. So this is a good one. He's a 10, but he thinks monthly contact lenses are more environmentally friendly. And I want to tell you that is false, because the amount of plastic it takes to make the cleaning solution bottles and the amount of plastic it takes to make the contact lens cases is years and years worth of dailies. Because when you have a daily contact lens, there is no cleaning solutions, there is no cases, and all you do is you open the blister, you put the lens in, you can recycle your blisters. Therefore, everything is recyclable, and you can just not worry about environment. So I have a lot of patients that are concerned about this, and I explain to them, and then that's how all my patients prefer to go to dailies, because of it is definitely environmentally friendly. Okay, next one. This is a good one. He's a 10, but he says he has cataracts in his eyes. So this is also a very good one. What cataracts mean, I mean, it's not a cataract, but it's a cataract. This has usually patients say that to me, and I say, oh, you have cataracts. I'm trying to like very gently let them know that it's the name of the condition, and what the cataract is a clouding of your natural lens. We see that with aging. Some patients that have some type of systemic diseases may have premature cataracts, but they're called cataracts and not catalects. So if he says that, I'd say, okay, whatever, you're 6. But I will correct them and let them know that is not proper way. Okay, so I have a really good one. He's a 10, but he uses apnique cosmetically. And I actually see someone here. Carly, I'm gonna add you because I'm gonna add you right now. Let's see if I can add you. Okay, can you request, Carly? I can see you're here. Do it, come. Let's see if she does it, because I don't know how to invite her. Oh, maybe I see it. I really want her to join me. It was actually, she is the one who inspired this. Hold on. Okay, I think she's coming. Let's see if she's willing to join us. She's the one who inspired me to do this because I think it's such a good way to have a laugh and to have a little educational moment. Maybe she's not ready for me. Anyway, so let's see. She's thinking. Maybe she's brushing her hair. Let's see. Okay, so he is a 10, but he uses apnique cosmetically. I actually love this because apnique is a new medication to treat acquired blepharoptosis. And what that means is droopy eyelids. I recommend this to my patients all the time, male patients especially, since they're kind of taken for granted. They deserve to look good as well and have eyelid symmetry. So I have a lot of young professionals who have born asymmetry of their eyelids. One is more droopy, and I always tell them, listen, you're number one, you will see better, because once that lid is lifted, you will have more light entering the eyeball and you will see better, but it's also going to give you that symmetry aesthetically. There's nothing wrong with it. So if he's a 10 and uses us apnique cosmetically, he is a 10. I respect that. Yep, he's a 10. He's a 10 and he fainted during contact lens training. So, I mean, that's okay. I've had firemen faint on me when I was putting the drops to check their eyes for glaucoma. And so it's there's nothing wrong with that. There's totally judgment-free zone. It's this happens because patients they hold their breath. It's called Valsalva, and they just faint, and it's very easy to bring them back. It's not a big deal. So if he's a 10 and he fainted, sorry, hope you didn't hit your head falling, and you're still a 10. No judgment. This is a good one. He's a 10, but he wears readers from CVS. Listen, if this is what makes you happy, I'm happy for you, but you should not be wearing readers from CVS. There's so many better alternatives to, number one, give you better vision, and you're going to look better, and there's other alternatives to correct your vision. So for example, if you're a 10 and you wear readers from CVS, what do readers from CVS do? They only work as magnifiers, meaning you're just looking through a loop. If you're getting your prescriptions that are perfectly match your prescription that you have, you will have not only things that are magnified, you will have them crisper, which is the main goal, to have things in front of you in crisp position. So again, when you're getting readers, you're most likely going to be, one eye will be overcorrected, one will be undercorrected, and you're not getting your optimal vision, and you're just don't look good. So if you're a 10 and you wear readers from CVS, you're 2. That's it. You're 2. So he's a 10, but he has red eyes. Listen, again, there are a variety of reasons why people have red eyes, but if it's something that happens chronically or you have red eyes for longer than 5 days, you need to take care of it. You need to understand why you're having red eyes. There's so many different reasons why you may have red eyes, and there's a variety of reasons to treat the red eye. So definitely check why you're having red eyes, treat it, and don't use Visine. They're like, all of these are so good. I can't even skip anything because they're so good. He's a 10, but he doesn't wear glasses because he thinks his eyes will fix themselves. You're 6 now because we know that eyes don't, your prescription comes from mainly from the length of your eyeball. So patients that are myopic or nearsighted wear minus prescriptions, their eyeballs are long. And once you grew a long eyeball, this is a physically long eyeball. You can't shrink it if you just do whatever you want to do to fix your prescription or fix your eyes or strengthen your eyes. It doesn't work like that. And people that are wearing plus lenses, they are, they're hyperopic. Their eyeball physically is shorter in length. And again, it's just something that just like you have shape of your feet, you have length of your feet, your hands, this is the same thing. Therefore, not wearing the glasses, you just blurry. I don't know, get the glasses or contacts, whatever. There is a good one. Yep. He's a 10, but he shows up on the Friday 5 minutes before closing time because he slept in his contacts for 7 months and now has an ulcer. This is a 0. You get a 0 because number one, there's so many things wrong with this. Number one, you shouldn't sleep in your contacts. You should not wait till Friday evening to come in for an eye exam for your eye emergency. And yeah, it's just don't do it. I think my patients by now know that if they woke up with a red eye, I want to know about it in 30 minutes because I'd rather treat them in the morning and see them. And we need more time to heal that eyeball, especially when the weekend comes. And this is summer, everyone travels, everyone needs an emergency contact lenses, or they're traveling, they have an emergency, they can't pick up their medicine. It just adds an extra layer of stress that is super unnecessary. Okay, let's move on. He's a 10, but he doesn't wear anti-reflective coating on his lenses. I would say that's an 8. I mean, I don't get it. I prefer my lenses with AR coat. It does help a lot with glare. Lenses really don't look good without an anti-reflective coating. They look very cheap. They maybe not, but they look very cheap because of that glare that you get. Therefore, I mean, I'd say you're 7 now. Just get the AR. Okay, he's a 10, but he always tilts his head on the slit lamp. So you know when you go in to get an eye exam and you sit in this slit lamp, the microscope, and a lot of patients just lean back we want you to stay still, and patients just like lean back, so we can't reach the patient. I mean, I'd say it's like not a big deal. I just keep saying, please keep your forehead and closer. I'll say an 8. Not a big deal, but yeah, it's kind of annoying. All right, this has been amazing. I still have, I might do part 2, but it's been so long. I hope you enjoyed it. I absolutely did. I think I'm gonna save it um, on my Instagram, just because I think there was some valuable information that may help you next time you go for an eye exam, which you should get every year, regardless you see well or you don't see well. You should be updating your glasses yearly, because vision, often, if you're an adult, your vision will be improving. So what I see a lot of patients, oh, I haven't had an eye exam in 6 years, my vision is great. Well, when they come in to see me, they're often pretty over minus. Their vision gotten better, and now they're wearing totally wrong prescription that could have been changed 5 years ago. So definitely get your eye examined. Always ask your eye doctor for an updated, newest technology, latest technology, newest contact lenses. And I hope you have a nice rest of your weekend. Oh, someone is saying, is it every year or every 2 years? I prefer every year, just because I do a lot of dry eye, I do a lot of ocular surface disease. So my patients, I actually see them every 3 months, every 6 months. So my patients do come in more frequently. But I have seen some eye care providers say, you know, you're absolutely fine. Let's just see you in 2 years. Listen to your eye doctor. They know best. They know your health history. So whatever they say, you follow that. But always ask questions. Always, always, always ask questions. If you don't understand your condition, say, can you please explain again? I promise you, we're happy to explain it to you, because we want you to understand. So I really hope this was valuable and you had fun, because I did. And we can do part 2 if you absolutely love this. So once I save it, you can comment, can we have part 2? Or you can just continue adding your he's a 10, and we'll do it again. I'm so happy to do it. I'm glad everyone is having fun. Have a nice rest of your weekend, and I'll talk to you all soon. Bye.